Good morning, or evening, or afternoon. My name's Tristan Cray. I'm a student of PTA at Kennebec Valley Community College, and I did my final evidence-based project on deep cervical flexor exercises versus other treatment options for relieving chronic neck pain. So why I chose this subject? I've had on-again, off-again neck pain since I was 16, and I was diving into research a few years ago about how I could improve it, and I thought this was really interesting, and that's what led me to, studying PTA. And patient incidents, I've noticed quite a few neck patients in my clinicals. Current relevance, we live in a world where we're all working on computers or hunched over smartphones. It's an increasing diagnosis that we're going to be seeing as we go forward. So I thought this would be a really good subject to learn more about. Now, these are the muscles, the deep cervical flexors that I mentioned. The rectus capitis anterior, rectus capitis lateralis, both work on the AO joint. Rectus capitis lateralis is actually stabilizes the AO joint during flexion, and then unilaterally it aids in lateral flexion. Longus capitis is the main one that these studies focus on. Longus coli, also a deep flexor, does not connect to the skull, but it does flex those cervical vertebrae. So for our first study, we're going to be going to Spain, specifically Sevilla, Spain. So get ready to eat some tapas. But before that, we're going to check in at the University of Sevilla, where some Spanish researchers are going to be explaining manual therapy versus therapeutic exercise in non-specific chronic neck pain. And this was done just a year ago, published last year in Trials, and the publisher there is Springer Nature, and they're looking at NCNP, which is means non-specific chronic neck pain. This is a 6-week program. They had 65 participants, and they had 3 outcome measures. One was the NDI, the Neck Disability Index, which all of these studies are looking at. The other was a visual analog scale for pain, so that's that 1 through 10 scale, but with a little visual scale that patients can point to. And the other was the pressure pain threshold, which is a device that you press your head forward into, and it tells you how much pressure you're exerting at the point where you start to feel pain. They had 3 test groups. Manual therapy received T4 mobilization, prone with the arms in a V, and a PT would press a fist right into that T4 vertebrae. Interesting. They also got grade 3 mobilizations to the C2 vertebrae, and they also got suboccipital muscle inhibition in supine. And the therapeutic exercise group started off with deep cervical flexion training with a towel under the occiput, practicing chin tucks and straightening out the back of the neck. And then they would also do that in sitting. And as the weeks progressed, they started to work in some more dynamic exercises like rotation and neck extension. The sham treatment is pretty fun to read about. They got a laser therapy device that was not turned on, but just pressed into the back of their neck. And then they also had somebody just hold their head without applying any traction or distraction or pressure. So that was the sham treatment. Kind of fun. Results. So the manual therapy group and the therapeutic exercise group both effectively decreased their pain, so that's great. Short term, therapeutic exercise group did have a slight advantage in the neck disability index, while the manual therapy group did have a slight advantage in the pain pressure threshold, and that makes sense. Exercise, obviously a little bit more functional. Manual therapy, you're getting some hands-on. It's going to work more like for pain reduction, so probably work more for the measure that the PBT, which is how much you can press forward without feeling pain. The therapeutic exercise group did have advantage in long-term PPT though, but they deemed it not statistically significant. So in the short term, you saw those differences between the two in the NDI and PPT. Long term, they evened out to the point where there was no statistical significance between the two. The strengths of this study were that it was a good sample size, 65 patients. It was double-blinded, and there was a control group, the sham group, which is pretty cool. I like their sham group. And limitations. There were no long-term results. 6 weeks they deemed medium term. And also the manual therapy group was older than the other groups by an average of about 10 years. Not really sure why, just a anomaly of how people got grouped together, I guess. So that was pretty good to hear that both of those, were effective, manual therapy and therapeutic exercise. Now we're going to go across the Mediterranean. We're going to go to Greece, specifically Thessaloniki, Greece. So get ready to eat some euros. And then we're going to hop over to the University of Thessaloniki, where some Greek researchers and one Canadian are going to explain their study that they did on cervical flexor muscle training and how it reduced pain, anxiety, and depression levels in patients with chronic neck pain. So this was done a few years ago in 2018. It was published in Physiotherapy Results International. And again, they're looking at chronic neck pain, but they're also looking at anxiety and depression, which you might have noticed when you're dealing with patients with chronic pain. There's a huge factor of anxiety, depression, the huge mental factor as well. And this is a 7-week program. And they had 60 patients, and they divided those 60 patients up into 3 groups. Everybody got the home exercise program. All 3 groups got the same program to do at home, which was rotation, and then stretches, and also some readings on posture and ergonomics. But the other 2 groups, the deep neck flexor group, used a biofeedback device, the pressure cuff behind the occiput, where you have the scale that's measured in millimeters of mercury, and the goal is to go up by 2 millimeters of mercury from 20 up to 30 and then back down again. That's the end goal that you're aiming for. It's really hard at first. I've done it. It's tricky because it's a very, very small movement that you're doing. So that's what they did for the deep neck flexor group. The superficial neck extensor group, they were doing neck extensions with a resistance band, which is kind of odd. PTs at my clinic remarked that they'd never seen that before, but it's what they did. And they did those for 7 weeks. And there were 3 outcomes that they were looking at. The numeric pain rating scale, so the same as the last one, that 1 through 10 scale, just without the visual aid. And the neck disability index, NDI. And then they also had the hospital anxiety and depression scale, which is pretty cool. It's like a 1-sheet form, just like these other, indexes that we use, like the lower extremity or, the neck pain index. And after the patient fills it out and you score it up, they have separate categories for anxiety and depression. So you get a separate score for each one, anxiety and depression. And the results of this were that the deep flexor group had the biggest improvement in pain and anxiety. Superficial flexor group had the biggest improvement in depression, and this was actually bigger than any other group in any other category. But this makes sense to me because deep flexor group, if you think about the activity that they're doing with the biofeedback device, where they're practicing going up in those 2 millimeter of mercury increments, it's sort of like a game. It's taking your mind off of whatever you were thinking about, and you're lying down, so it's sort of relaxing. So it makes sense to me that would have a bigger effect on anxiety. Whereas the superficial flexor group had a bigger improvement on depression, and that makes sense because you're doing a strengthening activity, you're maybe progressing the resistance band level, or you're doing more repetitions, so you're growing in a way, and I can see why that would have a bigger effect on depression. So both of these exercise programs are more effective than home exercise program alone, so that's good news. So the strength of this study was that it measured mental and physical states, which I thought was great because they're so intertwined. It was the first of its kind, as they love to point out, and it did have a control group. The control group was the home exercise program only group. Limitations of this was that it was a prospective cohort study, so that not quite as randomized as a randomized control trial. and it was just short of the 63 patients that they needed to deem it clinically relevant that they decided. And there was an uneven demographic split, which I've seen in all these studies. Actually, they're all about 75% women. Women are more likely to get chronic neck pain, and then possibly maybe more likely to volunteer for a study. Let's see. So this one also had some good news, in that you can decrease pain and anxiety and depression with these exercises. And you don't have to do either one. They split them up for this study, but you can do both with patients. So that's good news. Now, for the last study, we're going around the world. So get ready to eat some Vegemite and avoid some dangerous animals, because we're going to Australia. But first, we're going to stop at Queensland, Australia, Queensland University, where some Australian researchers, one of them has the great name of Gwendolyn Jull, and we're going to be looking at the effective neck exercise on sitting posture in patients with chronic neck pain. This is from a little bit ago, from 2007, but it was so relevant and I think really hopeful that I included it. And it was published in Physical Therapy, and they were looking at chronic neck pain, 7-week program. Again, 58 patients. They were grouped into 2 groups. One was doing the cervical, deep cervical flexion training, same program that I mentioned before with the biofeedback device, where you're trying to go from 20 millimeters of mercury up to 30 and back down again in 2 millimeters of mercury increments. The other group in this group was doing something kind of strange that I wish they would have included a picture for, and that was they were doing extension and flexion in in supine and prone, and they were progressing the resistance by adding little sandbags on the head or the body. I wish they would have included some visuals to show how that was done, because it sounds fun, sounds different, but they did not include any visuals, sadly. And there was also a control group, but I don't really consider it a control group. It was patients without neck pain who just did the initial assessment, but they didn't do the exercises or the final assessment either. So pretty much just 2 groups for this. And then they had 4 outcomes: numeric pain rating, that 1 through 10 scale, neck disability index, and then thoracic angle and cervical angle changes while distracted. So what they did was they had the patients sit at a computer, play solitaire, and every 2 minutes for 10 minutes, they would take a photo, and then they would compare the angle of their thoracic vertebrae and their cervical vertebrae to the initial angle when they started. So they're looking at how much that angle changed while they're, absorbed in playing solitaire. They're distracted. They're not thinking about their posture. So this was pretty cool. I liked how they studied this. The results. Both groups improved their neck disability index score and decreased their neck pain. So that's good. Both groups had improved thoracic posture. But the biggest change of any group in any measurement in this study was with the deep cervical flexion group that used the biofeedback device. They had a really big improvement in their neck posture. The angle of change of their cervical vertebrae was the smallest, and they actually had less angle change after the 7-week program, after 10 minutes of playing solitaire, than they did after 2 minutes of playing solitaire before they started the 7 weeks of training. So after 7 weeks of training, they had made a huge improvement. So I thought this was really, showed some really good news, and shows that there's a lot of hope for, improving your posture. So the strengths of this study were that it examined relevant activity, being at a computer when you're distracted. It's one thing to know how to, have better posture, but to actually do it while you're not thinking about it, I think, is the goal. And that's what this study was looking at. And that's what this study showed that patients really improved in. And patient compliance was high. All 58 patients began and finished the study, and it was double-blinded. limitations were that there were no measurement of muscle activity. They said they wanted to get like an MRI or some other measurement to show like, how much were the muscles actually, contracting, instead of just looking at the angle through photos. And there were no long-term measures, again, 7-week study. And then another limitation I would add to this was that they didn't really have a control group. So conclusions, strengthening deep cervical flexors does appear to improve cervical posture and decrease pain and anxiety. Especially as that last one showed. There's hope. Especially with the biofeedback device. It really can improve your posture when you're not even thinking about it. Other treatments also have similar results though. As we saw in the first study, manual therapy also had really good results in those same measurements. And in the second study, the one out of Greece, showed that the neck extensor training also had a good result in decreasing depression. So it's good to combine the deep cervical flexion training with other exercises and manual therapy. And the good news is that we can. We don't have to stick to one like they do in the studies. So my final conclusion is that more research needs to be done to determine whether it can be effective for a wider range of neck conditions. And I guess what I specifically mean is that, that these studies excluded everyone who had like comorbidities like peripheral neuropathy or osteoporosis or, degenerative disc disease, stuff like that, which is good for studies, but in the clinic we are going to be seeing those patients. So it'd be nice if we could see more studies that, do take those comorbidities into account. So those are my studies that I and image credits, and then I've also included a handout titled Little Muscles That Matter, and it goes into the explanation of those deep cervical flexors, their inferior and superior attachments, their actions, and then I've included 2 exercises for the deep cervical flexors. One's using the biofeedback device, and the other one's just cranial-cervical flexion, so that chin tuck with straightening out of the back of the neck, and then you hold that while lifting your neck up off of the mat or bed or wherever you are, and you maintain that position. So it's isometric hold with your head in the air while maintaining that cranial-cervical flexion. You go until you feel fatigue. You take a break, and you do that 3 times, and that's also a really good exercise for those deep cervical flexors. And then I've also included some helpful tips for work to avoid or decrease neck pain. Keep monitor at eye level, make sure the monitor isn't too far away. Practice the deep neck flexor exercises, and also practice some scapular stabilization exercises, since those have also been found to decrease neck pain. Support your elbows to take some of the strain off of the muscles in your neck and shoulders, and then take a micro break every 20 minutes. Be sure to stretch and get at least 1 hour of general fitness training every week. What they found is that even just that 1 hour, which is not very much, makes a huge difference in whether you're going to get chronic neck pain or not. All right, I hope you've learned something about chronic neck pain and how to help patients who have it. And best of luck in the future.